Good evening and welcome to Transition Talks Tuesdays. My name is Tim Markle. I'm director of the Children's Resource Center South. Sitting with me tonight is my son Hunter, and we are doing Transition Talks Tuesdays in partnership with Columbus School District Transition Program. And we want to give them a chance to go ahead and introduce themselves and say hi.
Hello, everyone. My name is Jaliyah Henderson, and I am the Columbus School District Transition Coordinator. And I am so excited to have Tim and Hunter here tonight. Hunter, right? I got that
Yes,
right?
that is correct.
Okay, good. It's so nice to meet you, Hunter, and I'm so excited to have you all here. So without further ado, thank you. And I'm excited to learn all the things from you two.
Well, no, you need to lower the expectations. So it's something that I told both of my kids is set your expectations low. That way you'll always get over. You'll always reach them. You'll always jump over. So they're not going to succeed a lot, but
what if your
they're gonna
expectations are already low enough to be the floor?
Oh yeah, that's right. We got to build your expectations up.
Yes.
Oh, okay. Well, we'll talk about mental health a little bit tonight as well. We are so glad to be here. I am going to go. Hunter, why don't you go ahead and introduce yourself while I go and get the screen going on.
Oh, yay. My dad gets to figure out how to do this yet again, everyone. My name is Hunter Markle. As he stated, I am his son. I am 26 years old. I have I have autism, anxiety, and depression, along with a little bit of stress from time to time with a lot of other things in my life, including my job currently. But that is neither here nor there, as tonight we will be talking about healthcare transition and how it impacts your life, your family's life, your student's life in this sense for Columbus, right?
Yep, Columbus School District.
Thank you. I almost accidentally called you guys Columbia.
We're not there yet.
No.
Maybe one of these days.
International or the District of Columbia School District?
International.
What? I'm just saying.
All right. So Hunter told you a little bit about who he is. I am
very quickly. Everybody can see the whole screen setup, correct? Just simply raise your hand if you can.
Yeah, I am efforting. What Hunter is talking about is right now I am efforting. Good. Thank you.
Thank you.
All right, so let's go on. So I'm his dad. I also work in addition to the Children's Resource Center South. I'm also part of the Youth Health Transition Initiative. Both of the Health Transition Wisconsin, Youth Health Transition Initiative, and then the 5 regional centers are part of a larger network in Wisconsin called the Wisconsin Title V Children and Youth with Special Healthcare Needs Program. Those are some of our partners up there. Hopefully you've recognized a few of them. Family Voices, they started us off with this series with their What's After High School. Remember, they have all sorts of fact sheets, including fact sheets on transition. And then Well Badger is a statewide resource center. As we'll talk a little bit about regional centers in just a moment, but also wanted to introduce you to a new network that we're a part of called the Wisconsin Wayfinder Network. This is the new Wisconsin Wayfinder Children's Resource Network. What the Department of Health Services has done is they brought a number of different programs together under one 877 number so that we could give out that 877 WISC-WAY number to families who have any questions about children and disabilities between birth and 21. So think about before if you had to go and find a who your birth to 3 representative might be, or your children's long-term support, or Katie Beckett Medicaid. Now you call 877 and we will make sure that you get to that right person, as well as you no longer have to really know which region you're in for what used to be the regional centers and now children's resource centers. You call 877 and we're gonna get you to the right place. We all still have our own 800 numbers because we've been in existence for over 15 years. And so there's a lot of families who already have our number, so we didn't want to lose our own number. But that 877 WISC-WAY will get you into the doorway. You'll be able to talk to a navigation guide, and we will help you find the support and the resources that you need.
Yeah, didn't Wisconsin Wayfair start like back in late of 2023? Because I remember you had me Yep, you had me talking to a few people about it at the Children's Come First conference when I was sitting at the table waiting for you to come in from DC.
That is correct. And so we are in, again, the Children's Resource Center South, which still says Southern Regional Center. I'll get this changed one of these years. But we will also send out the slides. But we are here tonight because we want to talk about health transition. So Hunter, can you tell a little bit about what Youth Health Transition Wisconsin, the Transition Initiative, Healthcare Wisconsin, what do we do?
Well, primarily we teach, teachers, other form of educators like special health educators, or just guidance counselors, counselors in general, be it again guidance counselors or legal counselors. We teach families, we teach young adults, we teach kids and everything. We have taught what, 2 different groups of Patch Kids.
Yep.
We have pretty much almost taught every single group about healthcare transition. The only group we have yet to reach out to, I believe, are firefighters, paramedics, police officers, and politicians.
I'm not sure I want to talk to any of those about transition, but
Well,
we'll
the
get there.
first three,
But we
I would
also,
agree with.
but we also talk to clinicians and hospital systems so that we try to encourage them. And we have Julie Hajewski on our line, who's part of our team tonight as well. And she's the one that goes around and tries to train and convince health systems to really take a hold of transition and that medical healthcare
You gotta
transition.
firmly grasp it with both hands so it doesn't slip through.
That's right, because we don't want anybody slipping through the cracks.
No. Well, there'll always be 1 or 2. Of course, we're human.
Absolutely. We're all going to make mistakes.
We're just gonna try our best to patch what mistakes are already there.
True. We do that. We also have a website. We do other outreach. We go through other partnerships. And what we really want to get to tonight is talk about this fact, how healthcare can be integrated into the other areas of transition in life, integrated transition. So what's the role of healthcare in transitioning to a job, transitioning to higher education, and where you live and how you live your life, and how important is that? But first, we've got to figure out, what is this healthcare transition thing we're talking about? So we're going to talk about that. We're going to talk about some skills that can be practiced before your youth and young adult turn 18. How old are you now?
26.
Okay, so you haven't been a teenager for a while now.
No, I have not.
Oh man, I'm getting old. And
You are
so
old.
Thank you. Then we'll talk again about how it impacts other areas. So first, let's just have a quick definition here. Healthcare transition is this process of changing from a pediatric model of care into the adult model of healthcare. So it sounds pretty straightforward, but
It's really not.
it can get really confusing. So I want to break down how I like to view healthcare transition. This comes from our friends at Got Transition. So if you think about it this way, before a child turns 18, we have all this time that we have time to prepare for them becoming adults, right? We're preparing them educationally. We're preparing them how to get along with other people. We're hopefully preparing them to learn how their bodies feel and what their bodies are doing, preparing their healthcare as well. And so we have, and this can start at 12 years or even younger in talking about healthcare transition. And then there's going to become this point in time called a transfer of care. And that's when they're going to actually move from a pediatric model of care into an adult model of care. And so the records will move. Where they go to the hospital may change. If they're used to going to a children's hospital, they're going to be headed to an adult hospital. How their visits are changing. Sometimes the adult visits can be a lot different than children's visits. They won't cover as much. You may have to set up more appointments. There's a lot of changes, the transfer of care. Hunter, can I borrow your arm? Thanks. And so then what you have is, for the rest of the time, can you slide your other hand over that arm as I talk? There you go. Is the rest of the time, starting from here, go that way. The rest of the time this is when you're fully integrated into the adult healthcare world, and it goes for the rest of your life. And so tonight we're focusing on this little area here. We'll talk a little bit about transfer of care, but the whole goal of it, where the adult, there you go.
Sorry,
but the whole goal of it is this rest of the life so that they could be as in charge of their health care and as healthy as they can possibly be for the rest of their life. And of course, this is going to be different for each person.
Can I put my arm down
You
now?
can. Thanks. That was really well done.
You're welcome.
Who needs to think about this healthcare transition thing?
Everyone.
Cool. Anybody in particular or special?
Adults, adolescents, young adults, those with special health care needs, be it physical, mental, or emotional,
Why do we want to call them
healthcare
out?
providers.
Why
it's a
do, why,
lot.
why do we want to think about those those kiddos with those youth and young adults with special healthcare needs or disabilities?
Because some of them might not fully understand what is going on, or they're mature enough on the far end of the spectrum to not even potentially be considered kids anymore.
Mm-hmm.
And everything due to either their disability or their living circumstances. We don't know.
Yeah, so we know that age is just a number. And so our children could developmentally be anywhere along that span as they hit 18. The world doesn't care.
No.
United States doesn't care. 18 is the age of adulthood. But we know that not every kid is going to grow and develop at the same rate, doing the same things at the same time. It's not going to happen. And so sometimes kids are coming into learning about the healthcare system, being aware of the healthcare system at different times. And so we want to make sure that no matter when they start to learn about healthcare, they're prepared for when they turn 18. The other reason is that with some of our friends, is their healthcare is really important that it stays consistent, that there's not a gap in that healthcare coverage, that there's not a gap in that delivery of healthcare. I mean, I could probably go a while without seeing a doctor. There's some
Not
people that I know,
recommended,
not
but-
recommended, but there are some people where they need those regular appointments to keep their body in check and understand what's going on. And so each person needs to understand their own healthcare course, their own how it's going to go. So again, it's a multi-year process. And what we're going to talk about tonight is we're just going to dig into the preparing for transition. We're barely going to touch on this whole transfer of care, and we're not getting into the adulthood thing. Okay. But
that is for another course.
Yes, there's
another group of fun people to talk with you guys. Well, hopefully fun.
Hopefully fun. I don't know what could be more fun than talking with you, though. I enjoy talking with you.
Watching a movie?
No, you're more fun. Okay, so let's talk about things. You're welcome. Let's talk about things that might change. Pardon our dog, if you can hear her in the background. It'll be okay. So we already talked a little bit about providers. So some people have, like you had a pediatrician.
Yep.
So do you know what a pediatrician is, what they're really looking for in kids? What's their whole shtick?
That they're healthy?
Yeah, they're looking for healthy kids, and they're watching how kids develop. So they're looking for how their bodies are developing, and they're all about the body growing.
Yep.
Okay. My body stopped growing taller sometime around 20.
Yep.
It hasn't stopped growing out, but it stopped growing taller.
Oh no, I actually would say it stopped growing out as well.
Thank you. Thank you.
It's just growing more white in the terms of hair.
But my doctors are much more concerned about my aging. They're concerned about my health, but not so much about development, as that's changed. So there's a different focus in the adult world. There's also could be different appointments for different things. A lot of times in the child world is a lot of visits can get bundled together. Whereas in the adult world, you may have to make sure that you have your blood tests done before you go into the doctor's office, and you may have to schedule with the nurse educator at a different time. You may not get to see her at the same time. And we already mentioned that the hospital may change. I mean, if you're used to going to the same hospital for 18 years, you kind of want to know in advance if that's going to change. And so all of these things are going to depend on your health insurance coverage. It's going to depend on your primary care doctor, and it's going to depend on your specialist. And the bad news is none of it seems to happen at the same time. Is you could have your primary care say, you know what, you're going to go away to college. I'll keep seeing you until you're like 21 or so. But then you might have a specialist who's just like, oh no, I'm just specially for the kids. You need to have an adult specialist. So it's really important that you write down who is providing the health care and then who's going to provide it when you turn 18, when your youth turns 18. So you can work on that beforehand. And so the best people to talk to are other parents and talking to your primary care physician. Do you want to tell about how you got your primary care physician?
Basically, it started with both him and my mom asking my physician at the time of what, 13 or 14 years of age, or
Mhm.
rather, I was at that age. The doctor definitely was
No,
not.
he was a little older.
Yes, definitely. And he simply asked, or they as simply asked the question of why? Why should I start seeing Hunter alone?
Right. So we talked to the doctor and we're like, okay, he's getting to be an age where we want you to spend a little bit of time alone with him. And he wasn't understanding why we wanted that.
Then he then came to me and asked the same exact question. And funnily enough, I answered the same way the doctor did by saying why.
So why do you think it was important that we wanted you to have that alone time with the doctor?
Because I was a teenager and independence was a very big thing for teenagers.
Yeah, we wanted you to be independent as you can be. We wanted you to be the one who your healthcare was about. Because I mean, growing up, the doctor would sit there when you were littler, it was always about, well, so how's Hunter doing and da da da. And we got to the point where it's just like, well,
I was
ask Hunter,
usually
he's right
sitting in the
here.
corner.
Yeah, I know, but it's like, you ask Hunter. He's right here. He can help explain it to you. Sometimes we need to
He had a
help out.
chalkboard.
He had a good doctor. So
I love
Hunter
my
ended up
pediatrician.
moving to my primary care doctor. What do you like about your care team?
For one, they actually laugh at my jokes. Two,
Supportive.
they dumb everything down to the level that I can understand it. And third, they see me for who I am and not just another piece of paperwork in their never-ending supply of
Yeah, a lot
paperwork.
of paperwork. Good.
It's amazing they have yet to develop arthritis.
So think about what doctors, what specialists, what primary care doctors, what hospitals, maybe a change in clinics.
Maybe
that
even
may
a
be happening
change
at
in
18.
pharmacies.
Maybe, but
Maybe.
usually pharmacies will see all
Yeah.
ages. But we'll talk about pharmacy prescriptions in a little while.
Yep.
But let's talk a little bit about decision making and supported decision making. So there's such a thing out there called guardianship. We had somebody come in and talk specifically about supported decision making guardianship. And that video is available on the Transition Talks Tuesdays Columbus website. And so please feel free to go back there. But I remember when you were like 17 going on 18 and you were having some vision problems, so we went in to have a
Closer
brain
to
scan.
18 to 19.
Well, it was
Let's say 17 to 19. Let's go with that.
17 to 19. But what I remember is we went in and you were going to have a brain scan.
Yep.
And I really wanted to see whether you had a brain.
This guy did not believe you already said that.
Yeah, I was just a little curious.
Yeah.
So
I wasn't, because I knew I had one, because if I didn't, I wouldn't be here.
good point. But luckily, the person at the counter overheard us talking about it.
And asked if we had a release of information.
Right, because I had forgotten that he had turned 18.
Yep.
And so I wasn't going to be allowed to go back and see his brain scan. I was not going to be able to talk to the doctor about it because he was legally an adult.
Yep.
So we used that release of information is he gave permission to the doctors to talk to me and his mom about what they saw in the brain scan, to go into the meeting with him, to go into the appointment, to help him out. So we have that release of information on file if he would need help with it.
Yep. And the only way those two are getting out of there is when they are in the granite city known as a cemetery.
Thank you so much for that uplifting thought.
You're welcome.
I appreciate that. As we go on to talk about powers of attorney, which you don't have yet.
Hallelujah.
Which we need to work on.
I know. That's why I was saying hallelujah.
It's really important. So powers of attorney, and I'm not a lawyer, so this is not legal advice, But what I like about the medical powers of attorney is that I know I want someone to be able, who I trust, to be able to make medical decisions for me.
That is the
in
key word
case-
there, trust.
Yeah, in case I can't make them. And so the powers of attorney could do that. Then we also have guardianship, which is basically saying you are incompetent in areas of your life, and you can't, someone else needs to tell you how you should live your life.
And again, trust is a very big thing with guardianship, as that is much more controlling over this person's life than powers of attorney.
Right. And there's some cases where, yes, guardianship needs to be in place. Absolutely. But for too many years, it seemed to be always the decision. And unfortunately, in the medical system, it seemed that if a child had disabilities, or especially an intellectual disability, that it was like automatically assumed that somebody should be their guardian, that they couldn't take care of themselves. And we've learned so much that that's just not true. And so now we have
Yeah, let's
something
not
called,
go down that can of worms.
right, we won't. But now we have supported decision making.
Why did I say that? You know
I-
what?
I-
I'm
I
just
don't-
gonna jump over that bridge and get back on track here.
Thank you. So, dude, what sort of decisions do you make all by yourself in your life?
My hospital visits, my
Now, if you had to go into the hospital, do you think you'd talk to us about it?
Yeah, maybe depending on what the appointment's about.
Okay, so there are some things that you want to keep,
Mhm.
that you may want to keep to yourself.
Right, like me going to my nutritionist.
Right. So, that's a really interesting. You want to tell that story? I
Yeah.
love that story.
So basically, one day I was talking to my primary healthcare doctor and their team about how I can gain weight healthily and what to do about it. And they recommended me to a not in care. What is the term called for within the health insurance?
In network.
Thank you. In network, nutritionist, that's dietitian, and everything. And both him and my mom spotted me leaving the house at the same time. And they asked me, "Hey, where are you going?" "Oh, I'm going to see my nutritionist."
We said you don't have a nutritionist, Hunter.
I did have a nutritionist. I still have the paperwork from said nutritionist, and I still am planning on using what they gave me to continue being healthy.
Right. So,
Well, healthy enough to be a functioning human being.
absolutely. Well, as functioning as human beings can be.
Yeah, especially when it comes to me.
Yeah. Well, I mean, but he didn't start off having that confidence
No,
to
no.
be able to
my
ask about
confidence
that.
was basically as empty as a hot air balloon in Alaska.
Yeah, probably not going to fly too well.
No, you are not going
No,
to fly
no,
well in Alaskan
no.
winters.
No. So then supported decision making is now a way that Hunter could say, you know what, there's these areas in my life that I need help making these decisions. Like, we're envisioning someday you might move out. And while I've dealt with landlords before, and I certainly wouldn't want to just leave Hunter to deal with landlords on his own, but I want to have a legal right to be there. I'm not going to make his decisions, but I can have him, he can decide to sign a supported decision-making agreement that then says, this person is going to help me. They can be present in the situation. You still make the decisions, but I'm there to help. And that can also be useful in a medical situation as well. The medical community is still learning about that and how the support decision-making agreements work with the release of information. But I know a couple of the families aren't here, is you might have some kiddos that even as they get to be youth and young adults, maybe their speech isn't as clear as anybody's going to automatically understand them, but you know exactly what they're saying. Well, maybe you have that support decision-making agreement, not because they have trouble making the decision, but because the other party might have trouble understanding what they're saying, and you want to help them communicate, or they may have trouble with processing. And so you could be there to help them understand what the doctor is saying, what the medical people are saying. They still make the decision, but they just need someone to support them in that interaction. So again, go back, look at the video. George explains it a lot better than I did. All right, let's talk about information sharing. So growing up, you loved talking on the phone.
What have you done to my dad, and why did you say such a lie?
You hated the phone, didn't you?
I did not like doing anything over the phone at all, period.
So
Still slightly don't.
So we had to coach you on how to call back in the day, call and
Yep.
make your appointments,
Yep.
what they're going to ask you,
Yep.
what insurance you had.
Yep.
We encouraged you to check in at the appointment desk.
Yep.
And now, through 17, 18, 19, because we had the release of information, we could still help, but we encourage you to do it more and more on your own. And then you discovered
My chart.
So what does my chart do for you?
Helps me make appointments, keeps everything about my prescriptions and other medical history nice in a good area, has all my healthcare team and everything, and just basically it is an amazing tool to use if you do not like using a phone or you do not have access to a phone and everything, which would be considering that, never mind. But it primarily is just what I said. It's a useful tool for those with high social anxiety or just social anxiety in general.
Yeah, so you can do everything online.
Yep. Safely in your own home and in pajamas.
Nice. The other thing to consider is when I was growing up, I never ran out of medication. Is my mom always made sure that my medication was refilled, and that was the same for you guys growing up as well.
Oh yeah,
it was like magic almost. But then,
well, most of our medications were over the brand.
That's true.
Over the
counter.
Thank you.
No problem.
Ah.
But there does come a time where you might have to refill a prescription.
Thankfully, not currently, but maybe in the future.
Right. And so what we like to talk about is helping youth and young adults understand.
Did in past, because antidepressant.
Right,
I was
you
on
have.
that for about 3 months before the bottle emptied.
And so, and learning, like you were on an
3 to 4
antidepressant,
months.
what was that supposed to do? What were some of the side effects? Learning about what that medication was supposed to do. A lot of our kids are on multiple medications.
Oh yeah, please learn their side effects.
Mhm.
Please, for the love of everything, do proper research on the side effects. Don't immediately jump to conclusions about them just because a family friend was on the same type of medication and they had these symptoms. Doesn't mean that you or the person taking the medication in your family will get the same symptoms. Everyone is different.
Yeah, we react to medication in some different ways.
Mm-hmm.
It's a really good point. The other thing to watch out, so knowing what the medication is, knowing what it's supposed to do, and maybe starting to put labels. When, like if your medication is from your cardiologist, maybe the heart goes onto that medication bottle. Is one thing that families have done.
And also make sure that the medication that the pharmacist gives you is the medication you were prescribed.
Yeah, so it's good to read that.
Read the label. Check the pills themselves as well to make sure that, hey, these are the pills the doctor did give me. These are the same pills the family friend is currently using. So these are the correct pills for what is currently I am prescribed.
And you can always, pharmacists really like to answer questions.
Oh, they are an amazing group of people.
So let's
very knowledgeable.
Let's move on to health insurance. So you mentioned the word
that.
You mentioned in-network, out-of-network.
Right.
Why does that matter?
Because you won't get stamped with a $250 bill or a $500 bill or a $600 bill because you went to an out-network doctor or a hospital.
So each health insurance has their own rules about where to go, who you can see, and what it costs at different levels.
More paperwork, everyone. More paperwork.
And usually, like growing up, I didn't think to teach them how to do that until I started really thinking about transition. Yeah. And then it's just like, oh, I need them to understand. And then my sister
ended up going to an out-of-care doctor.
That's right. She did. She did. She's the one that went out of network. She was just sick, so she went to the closest doctor, and we got a huge bill.
Yeah. And
so if I had done better at teaching her, maybe that wouldn't have happened.
Yep, I learned to stay in network because I didn't leave the house for
Right.
college.
True. It made it a little bit easier. But so understanding, even if you have a kid that's going away to college, is understanding what are the limits of that health insurance? What will they cover? Is there a larger network that may not be as cheap as your in network, but it's going to be cheaper than just going to any old emergency room or urgent care.
Yep.
And so understanding the what your
Intricacies.
healthcare system has set up for when somebody moves out of their geographic range. We've had to do now that my daughter is out in Michigan. We've had to figure that out. And if you're receiving public benefit insurance, Medicaid, Badger Care, then you're going to want to make sure that you are talking to the ADRC, which go figure, we also have a recording of them, talking about about when you need to talk about moving into the adult long-term support, about how long they can stay on Medicaid, whether that Medicaid is through Social Security or whether it's through Katie Beckett. There's going to be different times where that health insurance will end. Now, in general, if you have employer health insurance, your children will be able to
Which
stay
this
on.
guy does have.
Very thankful for, will be able to stay on until age 26, or
If they go through more paperwork and extra paperwork on top of paperwork, you can keep your kiddo on your employment thing through something that I can't remember because it's another anagram.
don't even remember either.
Not an anagram.
Not an anagram.
No, what the heck
But
is it?
yes, so your children, if your insurance company says, oh, yes, your child is disabled, you may be allowed to keep them on your health insurance for longer. Sometimes it could be time limited, like a year, which we found out. I thought it was just yes or no. It's not. Is they could say, okay, well, we'll give you another year, and then we'll look at it again next year. And so, but it's good to know, and it's something to think about for those people that don't have access to the public insurance. All right, so let's talk about some more skills that can be worked on.
Yes.
If I just all of a sudden had you grow up for 18 years and I did everything for you and I never let you make any sort of decision, then all of a sudden you turned 18, I said, guess what? You now have to make every decision for the rest of your life. How would you feel?
Am I allowed to swear?
No.
Then what the heck?
Right, exactly. And so we learn how to make decisions by making decisions. And so helping you.
Both good and bad.
Yeah, right. So how many, no, I'm not even going to ask how many bad decisions you think I
Many.
made in my life. Thank you.
I mean, for goodness sakes, you almost practically destroyed your liver during college.
Did not.
That's why I said
Was
almost.
Okay, you did say almost this time. But
The bus
I have
didn't
not
fully
made,
run you
but
over for that
I have
joke.
not made all the perfect decisions in my life. Have you
No,
made
you're
perfect
human.
decisions in your life?
The only perfect decision I've ever made was as a baby whenever I decided to go to the bathroom.
That was always, we were very happy when you made that decision, by the way. But yeah, so we're all this mixed bag. We make good decisions, we make bad decisions,
We make horrible decisions.
we make fantastic decisions. But we're not going to feel confident in making those decisions about our lives unless we have those practice going into 18. So helping young adults and youth make decisions all the way up so that they have that confidence when they turn 18, so they can make those decisions the rest of their life. Nice job. Also understanding health needs. Hunter already said everybody is different. And so helping our youth understand, what does it feel like when I feel great, when my body and my mind are just like, boom, we're like doing it, we're clicked in. And then what does it feel like when I'm like, it's not going so well, because maybe I need to do something to get me feeling better, or I need to be aware that I'm getting sick. And maybe that's really bad for me. And then we need to know what happens when I am sick. What do you do when the doctor's office is closed? Is it an ambulance? Is it urgent care? Do I call my mom? Do I call my aunt? Do I call Ghostbusters? Who do I call?
You call the on-call nurse, which is a part of your health insurance card, that has been given out to everyone within health insurance circles. I
Some,
almost
not
said
all,
rings.
not
I
all.
almost said rings.
Yes, so there is the possibility that there is a 24-hour call that your insurance may have that you can call and talk to a nurse or talk to a professional, or maybe it's going to be an online care. A lot of things are popping up online.
Yep, you can use my chart to do that as well. If you mistakenly put your card somewhere else and you can't reach it in time, or you
Right.
just simply forgot where it was because you don't
We
keep
all
it
lose
in your
things.
purse, wallet, or nail it on the wall.
Which would be hard to get off if you need to grab it for the door. So I wouldn't advise nailing it to the
No,
wall.
I
but,
would not advise that
it's
either.
it's a good idea.
Taping it, maybe.
So understanding health needs, making and checking into appointments,
Yep.
spending time alone with the doctor. We've talked about that. The whole
Yep.
sense of filling prescriptions, emergency contacts. Where are your emergency contacts?
Phone, for the most part, and that's pretty much it.
Yeah,
Still need to
because
set up that no card in case my
most
phone
of our
damaged.
most young adults these days have phones with them. And so there are places in the phone where you can enter in those emergency contacts. We have
Very
information.
useful.
Youth Health Transition has information about how to do that.
And hopefully a step-by-step link to a video on how to do that for Android,
And Apple.
Apple,
Absolutely.
Samsung,
Nah,
Google.
we just worry about the two main ones.
What, not iOS or
No,
Nokia?
No.
How about
Nokia.
those weird off-brands?
So the other ones, there's some other ones that we are not going to talk about. Still, usually they're mimicking the same iOS.
Oh, I know.
There also is this idea of helping kids understand and being able to talk to the doctor, talk to the medical team about their preferences, about who they are, maybe what pronouns they want to be called, maybe whether they like to have small talk as they go. And you enjoy small talk. You enjoy going
love
into the
small
doctor
talk.
talking to you, right?
Yep.
But there's some kids who are just like, I am here for my
Right.
medical appointment. I do
Just
not want to
get
talk
right
about
to
my
it.
hobbies. I do not want to talk about colors. I do not want to talk about how my day's going. This is a medical appointment. That's just their personality. And so, but understanding that then means that the care team doesn't have to spend time annoying the patient instead of helping the patient.
And sometimes the patient annoys the doctors
That's
enough that they
sometimes- that's
just
true.
get right to it.
That's true.
Luckily, I am the middle ground.
Yes. And so having there's
Mostly.
different about me's that are out there. If you Google about me medical, that get more into those ideas of preferences and something that you can ask the doctor, the care team to look at beforehand.
Mm-hmm.
A more formal document is called a shared plan of care. And remember, we were talking about this transfer. And so a shared plan of care is made at any age. But it is a goals, like specifically goals around the medical system that are shared with the doctor, the family. It may have something to do with school, the family and the doctors, they agree on these goals and who's going to do those goals. And well, that shared plan of care, as well as any other important medical information, you're going to want to get your hands on before 18. Because as good as a medical record is, which it's really good, you don't know exactly where you're going to finally land with doctors. And so you want to make sure that you have this summary of the major parts of the healthcare, major surgeries and everything, and that you have a copy of that just in case the care changes, like insurance changes or the system changes.
Yep.
So
very key.
All in all, when we're talking healthcare transition, what we want to encourage is that you stay a step ahead, is that you think about that end goal, that we're going for that life, and at what age with your child or with you would be appropriate to start talking about these different skills to help them take charge of their own healthcare. Now, also in the section on the slides that we'll send you is we do have readiness assessments. There's a number of them out there. This is an example from our friends at Got Transition, which is a national resource around healthcare transition. This basically is the ability to sit down with your youth and sit there and go, yep, I need to know this. I don't know this. I need to know this. I don't know that, but I'm never going to do that. Somebody's always going to have to do that for me. Or I know how to do this, and this. I am taking charge of my healthcare. And then it can give you then those goals to work on. So you don't have to think of it all at once, but you just specifically take, this is what I'm going to work on. Some of those goals can be worked on in school. We'll talk about that in a little bit as well. But
Hopefully.
there's the link to Got Transition.
It's in English and Spanish.
Absolutely. Now, healthcare isn't the only transition in the world.
No, it's
No.
not.
We're looking at usually school transitions, work transitions, that whole decision making we talked about,
Mhm.
where I live, who makes those decisions for
Right.
me.
Of course,
Um,
always a key thing there.
But at the core, I think of all of that is health.
Yeah.
Is our health increases our independence.
Mm-hmm.
Do you do better during your day when you're feeling healthy? When you're mentally healthy?
Yes.
And when you're physically healthy?
Yes.
And did you do better at school when you were healthy?
You would have to ask my teachers.
Good point. But you work now.
Yes.
Do you enjoy your job better
I love my job.
when you're feeling healthy? Is it better?
Yes.
So it's important in health. Health is like, I like to think of it as foundational to succeeding in these other areas. Such as if you have high schoolers in school and health, as we know that all students.
They're looking at a blank slide. Why is there a
I
blank slide?
don't know,
There you
because I
go.
think I put animation in and then I forgot I put animation in. I don't know. But all students with individualized education plans are also supposed to, at age 14, start to have a post-secondary transition plan, a PTP. The PTP sets goals for what they want to do after high school and what they're going to do during high school to reach those goals. The PTP supports the IEP, but it is separate. Healthcare goals can be a part of the PTP and the IEP. Right now, you'll see them in support of what's called daily living. But I also believe that it can be written in support of employment, in learning about how do I share my healthcare information with somebody. We want students in Wisconsin to be graduated college and career ready. I very much believe that to be college and career ready, students have to maintain their health to be able to succeed. Now, there's also individualized health plans that the school nurse looks at how to set up a care plan for a student. Those are skills that the nurse can work on them to help them manage their own health care as well. Your student may also have an emergency action plan that if they have if something goes horribly wrong, something needs to be done right now, right away. And who's going to do what? That emergency care plan. Now, what I want to remind parents of, and that I remind schools and school nurses of, is the fact that if a student has this individualized health plan, and especially if they have an emergency care plan and they graduate, just because they graduate doesn't mean they're no longer having emergencies. So
No.
can we help them set up, what would that emergency care plan look like outside of high school for the rest of their life? What does that need to look like?
Yeah.
And working on that. Now, luckily, the education system has a lot of really great information out about transition and working with transition, especially with Transition Improvement Grant. And that will all be in the slides that we send you.
Yes.
Now, some of you, like you spent a little time at higher education.
I spent about like 7.5 months into like the beginning of COVID.
So what were the important parts about health and going to college?
For one, not catching COVID.
Yes, because it was getting there. But
Yeah.
what else did you do beforehand to prepare you for college as someone with a disability?
I got in contact with their resource center for those with mental disabilities and other health disabilities. Learned they had a guidance counselor group and everything. Learned who to talk to and everything. And I set up with their assistance on how to succeed in college.
So you used a lot of
To a point.
Right, because the IEP and all those accommodations from high school didn't come over
No.
in college. Is
No,
college
they're
is a lot
not.
more, you have to be the one that talks to them. They're not going to
Yep.
come after you. So
No.
you set up that appointment with the Disability Resource Center. You
Yep.
talked, you knew where the counseling center was and your mental health help.
Yep.
And so you really took charge of that.
Oh, very much so.
Now
And
let's
your
talk a little
animations
about
are still
employment
broken.
and no, I'm clicking. It's just
I
fine.
know, it's just,
Do you know what disclosure is?
Yes.
What's disclosure?
Disclosure is making sure that people know things about you that you want them to know. Don't disclose over social media,
It's a good thought. Very good word.
especially when it comes to health.
So you have some health needs.
Oh, 100%.
How did you talk to your employer about your health needs?
I ensured that it was just like one-on-one and told them, hey, this is what I have. This is what I need for a bit of a small amount of accommodations.
Mhm.
Is there any way you can help with that? Oh, and please don't disclose to everyone in the store.
Right, because disclosure means you finally get to tell people what you want them to know about you.
Right.
Growing up, I was the one that got to tell everybody about you. Now I ask your permission if I
Yes.
could talk about you, because you
Yeah.
should have the right to your health information. Who knows your health information?
Yep.
And that includes with your employer. You get to decide.
Yeah.
But because you did disclose, is then you knew that you could ask for accommodations.
Yes.
Cool. We also have some resources. Job Action Network is one of my favorites, and we'll include that in the resource sheet that we send out as well. The other thing that sometimes isn't thought about with employment and health is this whole idea of, what do I do if I'm sick?
Luckily, I've never had to call in sick.
Yeah, you weirdo. I've called in sick, but you haven't. But do you know what to do if you
Yeah.
like wake up and you're like not going to be there at noon because you're like not feeling well?
Yeah, I called the store number and talked to one of the 3 managers.
Okay.
Well, yeah. 3 managers, 2 assistant managers, and department leads. There we go. That was
Okay.
the other one.
So you know who to call,
Yep.
and you don't get sick days, so you're not going to
No.
get paid unless you show up to work. So you know
Correct.
that,
Yep.
but you have to know the rules for your employer.
Yes.
Good job. And you do.
Oh, I 100% do.
And then just in general, thinking about housing and life. So I haven't asked you this in a while. This is always interesting. You gonna live in my basement forever?
Potentially.
Potentially, you might. Do you ever think about moving out to your own place?
Yes.
What sort of things would you want to, like, where would you want to be? Do you want to be somewhere in the middle of a big city? Do you want to be in a small town, rural somewhere?
I would prefer staying within the boundaries of Stoughton.
Okay, so
and
you like
everything.
Stoughton.
I love
Now,
Stoughton.
Stoughton doesn't have public transportation or buses.
That's fine. I got my own car.
Okay, so you have your own car, so you have your transportation handled.
Mhm.
Now, some people aren't really good at directions. How are you going to find your way around?
Google Maps.
Yes, very good. And using that GPS on your phone. That's wonderful, isn't it?
It's
I
amazing.
love that
It's
thing.
amazing.
Love that thing.
Just
So-
wish they didn't have such an annoying voice.
But sometimes we need to think about, how am I going to get to places? What's my mobility? Is it close to groceries? How am I going to get there? Who's going to take me? Along with the fact that
How am I going to pay for it all?
right, is paying for it, and that whole sense of, depending on if you have public benefits, how much do I work to keep my benefits, or maybe you don't have benefits, so how do I make
Do
more
I earn
money?
enough to pay for my groceries, my
Right.
car, gas, rent?
Am I going to need a roommate? All these questions that you got to think about before just,
Mhm.
I want to move out to my own place.
Right.
There's a lot that goes into that.
What
and
stuff
that's
should
gonna
I
take
bring
time.
with me? What stuff can I
Mhm.
sell for good, quick, easy rent money on eBay?
Right, and then along with the questions of, what? Black mold isn't fun.
Correct.
Dirt is not great.
Yes.
There's a lot to be said about
a lot
staying
more-
healthy by keeping
Mhm.
clean.
Yep.
And sometimes some of our kiddos need reminders
Oh,
about that.
Hi.
And if you move out, chances are you're not going to have somebody reminding you. So you've got to figure out, while you still have the safety of a backup plan, how you can get yourself to do that cleaning, to keep yourself clean, before it gets dangerous.
Yep. By the way, we are going to release everyone at 7, correct?
Absolutely, positively.
Okay, good.
Yep. Why are you keeping an eye on the time
I
somewhere?
am keeping on the. We have a clock up there.
Oh, okay. Oh,
Yeah.
I never noticed that. Along with, so then the other thing to think about is to go with housing and life is exercise
Right. Yeah.
and keeping your body in good shape, no matter.
Yes. Good.
Thank
Good.
you.
Good shape. Good shape. I'm not one to talk because I don't have as much. Well,
Padding. Let's just say padding.
I was going to say extra weight.
Okay, I prefer padding. But yeah, everybody's body is different. And so one thing isn't going to work for everybody.
No.
But to have maximum health, no matter what your ability or disability is, and that's going to look different for each person.
Correct.
And that also goes with our mental health,
Oh dear God, mental health.
is being able, learning how to keep ourselves from being overly stressed.
Or
From-
under stress.
Right, from getting too lethargic.
Yep.
How to stay involved,
Mhm.
keeping up with our hobbies, how much socialization do I want? Am I okay with just having like 3 or 4 people that I know, or do I want to know 25 different people?
Or do I want to know over 300?
Exactly. And do I want to know them all in person or just through Discord?
Right. Or do I just want one specific friend?
Exactly. We're all going to be a little bit different, but knowing what keeps us healthy, what keeps us full,
Mm-hmm.
and then being able to figure out how to get there and then plan for that
Now I'm
success.
thinking of friendship as a gas station.
Please don't. All right, we already talked a little bit about rights and health, but just again, I want to reiterate the important part of who's going to make those healthcare decisions when the young adult turns 18, the youth young adult turns 18. Remember, we talked about the decision-making support tools. This is borrowed from our friends at the Board for People with Developmental Disabilities. Their link will be at the end of the slideshow as well. But again, a lot of what we're talking about can be summed up by talking about self-advocacy.
Mm-hmm.
How would you define self-advocacy?
Being willing to carry your own banner, your own weight, your own rocks into an island of other people saying, hey, this is me.
Yeah, excellent. This is me. And these are the things that are important to me.
That is the first time I've ever come up with that analogy. I love that analogy. I want to try and keep that analogy.
All right, keep that analogy. So basically, to sum up before we get to the resources and any questions that you might have,
Oh, hey, Pacer.
I wouldn't, pay. So they're on our
Yeah,
resource
you
slide.
can go back in the sites and actually check out that
We'll
website.
send them to you. But wherever you are looking at, wherever you're at and transitioning with your youth, how can you bring health into that transition area? Because that health is going to result in a better life. And so whether it's adding it to a post-secondary transition plan, to an IEP, whether it's meeting with the Disability Resource Center, whether it's figuring out who's the therapist after they turn 18, maybe it's learning pre-employment skills such as how to keep myself clean, how to talk about my disability, how to talk to employers. Maybe it's working with employment agencies. Maybe you work with an employment agency and you're like, wow, maybe I should have the students that I have on the job learn more about how to talk to their bosses about their health and what their needs are. Whatever area you are working in, health can be a part of that to help succeed.
So to reiterate, what is healthcare transition? It is a multi-year process that starts at age 12 or younger, goes through a transition of care around 18, 22, maybe a couple years younger, maybe a couple years older, and then it fully integrates into an adult healthcare system for the rest of said person's natural life, be it an extra 30 years or an extra 100 years. We don't know.
Excellent. So we have some resources. I just noticed that this one still reads Southern Regional Center, so I really have to
You
get
gotta
the
buckle
right name
down
there.
on your
Sorry about
headache.
that. But we do have, besides Columbus, we've done other transition talks Tuesdays, so there are other
You get to see
topics that
these
are out
two
there.
beautiful people talk more with other groups.
Some nights we do better than others. We got to, just so we're
And
honest.
some nights are just pure chaos.
We've had those nights. We do have a link to Got Transition, our national resource, as well as the state Health Transition Wisconsin. There you can find all of the
This the 8
tools,
tools you would.
the tools that we talked about.
Yeah, this is that you were hoping for.
Along with there are true. There's also a workbook that goes along with another training that we do called Build Your Bridge.
I believe that was also with Columbus, or was that with a different school district?
I don't remember where we did that one.
Yeah.
Pacer Center is in Minnesota, but it's fantastic. Up to me, as we are trained facilitators in that. It's talks about how to disclose, how to talk about yourself.
Yep.
We're hoping to run a
An up to me program
session in the spring. Patch providers and Teens Communicating for Health. They are wonderful. They go and they talk to doctors. They are teens that go and talk to doctors. They talk about rights and responsibilities, and how doctors can better communicate with teens and how teens can better communicate with doctors.
Yeah.
There's our Friends Transition Improvement Grant. You can go out to, you too can go out and get a PTP. You can look at it, you can go through it. They've just made some changes to it, so now you don't have to do it all in one sitting. They also now have it available in Spanish, so there's some wonderful upgrades to the Transition app. If you want to look at job stuff, you're going to need to know about Division of Vocational Rehabilitation. We'll be talking with them as well. And then there's not Job Action Network. It's the Job Accommodation Network. If you want to know more about disclosure and how to talk to employers about disability and healthcare needs, the Job Application Network. More about supported decision-making would be the Board of People with Developmental Disabilities. There is a training coming up on supported decision-making on April 10th. So notice that when we send the slides out, you want to get registered for that. I am looking forward to it. It's online, so wherever you are, hopefully you'll be able to find that time to attend. Also
7 o'clock.
Family Voices of Wisconsin, as well as our friends at the Wisconsin Transition Integrated Transition Planning Process. So in the end, stay a step ahead. I'm Tim.
That's 3 sides.
This is Hunter. Please take a short evaluation. Click that sucker. If I could, I would sit there and I would put that into the chat. And that was.
But we're not that good at technology.
No, I am not. So we're gonna stop sharing. We'll send it out to you, but please, when I send it to you, take the evaluation. I know we're at 7 o'clock. But please, any outstanding questions that may be out there, apologies for going so fast. I keep redoing this and I haven't got it right yet.
4 times he has re-edited this slide. 4 or 5 times you've edited this slideshow.
So any questions before we close out for the night? Everybody's like, that was a heck of a lot of information.
Yeah.
Okay, well, hopefully we will see you back next week.
Kind of lost the people from Columbus.
So yes, we did. So thank you all for being here. Have a fantastic night.
Bye, everyone.